Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Carbamazepine. Okay, carbamazepine is an immuno. It is an immunostilbene derivative. Carbamazepine is an immunostilbene derivative. It is also a sodium channel blocker similar to phenytoin. So this carbamazepine is actually a tricyclic antidepressant analog. The overdose of carbamazepine can result in medical emergency. Treatment of the carbamazepine is almost similar to tricyclic antidepressant analogs. Then pharmacokinetics of carbamazepine. In the pharmacokinetics, the carbamazepine is well absorbed and the food increases the absorption. Carbamazepine is an auto-inducer. That is, this carbamazepine will actually, it is an auto-inducer, so it induces its own metabolism. Carbamazepine is a short acting drug and it is metabolized into 1011 epoxide. Because it is metabolized into 1011 epoxide, and this 1011 epoxide is actually responsible for the side effects of carbamazepine. Then the uses of carbamazepine, first interactions, drug interactions of carbamazepine. Because this carbamazepine has many drug interactions, carbamazepine might result in OCP or oral contraceptive pill failure. So carbamazepine should not be given with oral contraceptive pill. It can also cause phenytoin induced, there occurs phenytoin induced metabolism of valproate will occur. How does this phenytoin induced metabolism of valproate occurs? Actually, the valproate, that is sodium valproate, will mainly displace the phenytoin from its protein binding sites. All most of the drugs will bind to the plasma proteins. Now this valproate will displace the phenytoin from its protein binding sites. So similarly, uh, these will also metabolize carbamazepine. Sorry, these will also displace carbamazepine also, causing its decreased action. Then use of carbamazepine. Carbamazepine is used as drug of choice for partial epilepsy. It is used as a drug of choice for partial epilepsy. That too, it is used as drug of choice for temporal lobe epilepsy. It is used in the has it is also used as a drug of choice for all neuralgias. Neuralgias of all types we can use carbamazepine. Carbamazepine is also used in bipolar disease. Mainly it is used as an adjunct in the bipolar disease. Then side effects of carbamazepine. Carbamazepine, the most common side effect of carbamazepine is rashes. It can cause hepatitis. Neutropenia is reported with carbamazepine. Sorry, syndrome of inappropriate antidiuretic hormone, where you can see dilutional hyponatremia is also seen in carbamazepine. So because of this side effect, because it causes dilutional hyponatremia or syndrome of inappropriate ADH secretion due to increased retention of, that is in dilutional hyponatremia or in syndrome of inappropriate ADH, there is retention of water is seen in our body. So as a result, this side effect can be converted into use by using the carbamazepine in diabetes insipidus. Then carbamazepine metabolism. Carbamazepine metabolism is also inhibited by one drug. Carbamazepine metabolism is inhibited by the drug called as dextropropoxyphene. But this dextropropoxyphene, when it inhibits the carbamazepine metabolism, the carbamazepine levels in the blood goes up or they shoots up, so it increases. So when carbamazepine levels in the blood increases, this results in the toxicity of carbamazepine. So this is one more drug interactions.
Thank you and thank you for watching.